a neuropsychological evaluation. And so we were evaluating different aspects of cognition, attention, executive ability, language, memory, and just to see where there are difficulties that we could document, kind of where you're at right now in terms of your function. Also, what areas are you not having difficulty with, and then what areas you are. So I have some findings to talk about. And then some recommendations. So, anybody have any questions before I start?
No.
Okay. So I'm going to talk about attention, then I'm going to talk about executive ability, and then I'm going to talk about language and memory. Okay. So I always talk about attention first. Attention is the gate, right? It's the way you get information in. And just so everybody's on the same page, there was some concern for you, Len, I know, in terms of taking your stimulant medicine for attention, right? And so we do testing off of that. So that means that if there is, that means that I think it sounds like there's a lot of benefit from that medicine. And so we know that the attention that we saw is sort of you without that being treated. So there were probably more problems with attention because of that, right? Because you were not being treated for your attention problems. Okay. So we saw difficulty with sustained attention, and we saw difficulty with divided attention. Sustained attention is your ability to maintain focus over time. Okay, so like, for example, I'm speaking right now, and that is not information that you get all at once, right? It's distributed over time. And so what happens is with the sustained attention difficulty is that there are lapses that can occur with your attention. And they can be quite brief. It could be a moment where you break concentration and get pulled off, but it doesn't necessarily have to be that. It can just be a dip, and then you kind of pick up again, and then there's another lapse. And so these lapses are happening. They're happening with both verbal information and nonverbal information. So it's just an across-the-board difficulty with sustained attention. And there's also a reduction in attentional capacity. So the overall amount of information you can hold in mind at once is reduced as well. Okay? Does that make sense what I'm describing?
Yeah, because I've always had a problem my whole life that's why I have the deficit disorder. And one of the things that they did recently was to reduce the amount of Adderall I was taking from 20 milligrams to 15. I don't know why Gail decided to do that, but that she did. Because I've always had that attention deficit disorder. I mean, it was a problem in my whole life. And it makes a real difference, my ability to maintain myself in terms of the way I think and how I deal with things. So I'll talk to Gail about that on whether she'll go back to 20 milligrams because...
and you said that you're not sure what the rationale was for increasing that?
Decreasing.
Decreasing it.
I'm sorry, decreasing that. That's what I meant. I'm sorry.
I have no idea. I think she thought maybe... I think she thought that, well, it's about time you reduced it. I was, as a young man, I was a disaster in school. And I couldn't pay attention. I couldn't keep myself going. And I went from
We know that, Daddy. Yeah. No, I know that medicine has been helpful to you. And so, and I know that we evaluated you off of it. So we were seeing sort of all the attention difficulty. And that's not just you now, right? That's you throughout your whole life. That's been a problem. There may be more now. It's hard for us to know because we didn't evaluate you then, right? But we do see a very significant sustained attention difficulty and also trouble with capacity. So the overall amount of information that you can hold in mind. Okay.
Yeah.
And one other area of attention where you demonstrated difficulty was what we call divided attention. And so divided attention is your ability to hold information in mind in the face of distraction or interference. It comes up a lot with multitasking. So that's that getting pulled off. You know, that's switching to something else, and then can you switch back to, can you pick up where you left off on whatever it was that you were doing over here? So these attentional difficulties are, we documented them. And again, we don't know, it's hard for us to know the extent to which these are different than how they've been. But there is a significant amount of difficulty in all three of those attentional domains, okay? And that's important, right? Because that's the gate, right? That's how you get information in. And if there's disruption in your attention, that's going to affect in turn understanding and in turn memory, right? Because if it doesn't register, if it's incomplete, what registers, or things get bumped out along the way before they get a chance to get encoded, then you're going to have more difficulty with comprehension and retention. Okay? Does that make sense, what I'm describing? So it is important to talk about attention and think about that.
Yeah, because when I was having, before Adderall, I was a C- or D student in school. I couldn't keep myself in going. Mm-hmm. And I went from a C- D student to, when I got Adderall, to an A student. Mm-hmm. And it was a miracle for me.
Yeah.
And
so, Dad, you just got to remember, all this testing is without the medication, so we don't know how great you are now with it.
Yeah, okay.
Yeah, I mean, we know from your description that it's very helpful to you. So we know that helps with the attention. And so the extent to which the attention affects some other things that we're going to talk about, that is helped by the Adderall, right?
Yes.
So we can improve. We know that can be improved from your experience. We know that. In terms of executive ability refers to higher order functions like planning and problem solving and organization, and also what we call control, cognitive control. And there was you showed some difficulty with those executive functions, trouble with planning and planning out a problem solving approach, and some disorganization, especially when they were complex. When the problems were more complex, you had more difficulty. So it was hard for you to hold that information in mind moment to moment and put it together and take an approach that was a gestalt approach on certain tasks where it's helpful to kind of look at it as a whole and you can hold it in mind. That's harder for you to do.
Yes.
And one thing to keep in mind with this is executive ability does play a role in emotional function. So in terms of especially that control aspect that I mentioned, this cognitive control. So if you were having trouble with cognitive control, if you have reduced control cognitively, you can also have some emotional coping difficulties. So that may be part of why you've been feeling more anxious. Is relatively greater difficulty managing or controlling that emotional response. So it's kind of like, you can think about it like the response is bigger, and then it's harder to kind of cope and move past it. So it sticks with you. And so that's there's a cognitive component to that anxiety.
Okay, because anxiety is something that I have to deal with if I'm not taking Adderall. It really makes a difference.
And that's sorry.
I still have problems with anxiety.
Mm-hmm. And I think part of that, you're probably scared. I think you're having problems with problem solving And I think that would make you anxious too, if you're feeling out of control or not being able to remember, moment to moment.
Yes.
Yeah.
I could get panicky because
Very easy over very small things.
Yeah, and so if you think about it, I agree, and I think that part of emotional coping is a problem solving task in a way, because things happen, there are stressors that we encounter, and we have to manage them, right? We have to make that adjustment, and that adjustment is made more difficult when you have some executive difficulty. Now, the fact that you feel less anxious with Adderall demonstrates that a stimulant does help with attention, but it also helps often with aspects of executive ability. So that's sort of another demonstration that is helpful for you. It's not uncommon for us to hear that people feel more emotionally stable or less anxious or more in control on a stimulant, because these things are not unrelated. Emotional coping, information processing, that's all happening in your brain.
Yeah. The other thing is that I'm afraid that my children, some of them, not all of them, had that same problem they inherited from me. And I always feel bad about that because...
What are you saying, Dad? You think it's me? I'm making a joke. It's me and Caitlin who's on the call too.
And Caitlin says the same thing. So I feel like I gave them some unbelievable problems
Hey,
to
I'll
deal
take that over the cancer or heart history, okay?
Yeah. So it's an inherited kind of problem.
Yeah.
Sure, one of your parents had it. It's there, Daddy. Don't worry about that.
Yeah.
Yeah, and another thing to remember is think about how, and you mentioned this when we first met, how much the stimulant made such a difference in your life. Discovering that allowed you to tap into your abilities and and achieve and have a career that was so gratifying for you and where you were really successful. So it's great that it was treated from a young, relatively young age, not when you were a child.
When I was it was in the 60s that I discovered it accidentally.
We know.
My wife at that time was working for a place called Smith, Klein and French, and she wanted to be skinny, and she would fill her pockets with, it wasn't called Adderall at that, it was something similar.
Amphetamine.
Don't talk about Mother's theft history. We know.
Okay, you don't need to hear that history.
So,
Just decline that, Daddy.
I won't listen to her.
So in terms of language, so we did some evaluation of language, and obviously as we talk here now, you are able to express yourself, you're able to understand what other people are saying. There aren't any comprehension problems in conversation, but there are some indications of some language issues on formal assessment, mainly in terms of fluency, so word finding difficulty, some trouble naming objects, coming up with the right word. But again, when in conversation, my guess is that you're able to find another way to express it, to get out what you want to say, because that's how you described your experience, is that you're able to express your ideas, and I can certainly understand what you're saying, and that you are able to understand what other people are saying as well.
I can.
Yeah.
One problem I have is I'm a terrible speller. I've been trying to get through it for years, and my kids laugh every time they see anything I write because I have to really struggle to spell, and and so I'm very sensitive to that.
Yeah, and you mentioned that was developmental. You grew up with, as poor speller.
Oh,
Yeah, so I think that's probably related to the attentional disorder.
and I had problems with trying to learn the language too. That was a terribly hard thing for me. I managed to get into school because I wasn't very good with mathematics, and that was my savior. Because when I got in the doctoral program, they required to take a language, and one of the things they did, they said you could substitute a language with mathematics, and that was an easy trip for me. So, but it was I had trouble with that too.
So yeah, and that when we see you now, right? You're sort of we have you your whole life, right? Your cognitive strengths and weaknesses, but now here you are, right? And there's been some changes that have been apparent, in particular with memory. And so we did a few memory tests where we teach you some things and see how well you learn and remember and where you have difficulty. And what we saw was you do have a lot of trouble with learning and memory. Learning is you have to learn something in order to remember it, right? So even a conversation, that involves learning, right? Because you have to learn what the other person was saying. And there was some effect of the attention and executive deficits on learning and memory, right? And that would make sense, right? If it doesn't get registered, then you're going to have trouble encoding and then remembering it, right? And then learning is an active process. So if there's some disorganization or problem-solving difficulty in terms of executive ability, then the way that you represent that material in mind and organize it, if it's scrambled in some way, then and you encode it into memory, distorted or and maybe incomplete because of some of the attentional problems, then when you go to retrieve it, it's also maybe distorted and incomplete, right? Because that's the way you learned it. What we do is we try to reduce the demands on your attention and your executive ability to see if there is still problems learning and remembering. And what we saw was, yes, there's an independent difficulty with learning and memory, independent of those attention and executive deficits. So even when we reduce those demands, you still have trouble learning and remembering in certain contexts. You have relatively less difficulty learning in an environment, for example, where there's a narrative, which I thought was really interesting. So if we tell you a story, it may get scrambled somewhat, but you remember a lot more of the details. The structure of the story helps you. And what I think is interesting about that is and Madison and I had talked about this, that's what you did, right? That's what you did. You listened to narrative. People would tell you their stories. And you have a lot of skill there in remembering the story. So the story is the thing where you have the least difficulty remembering. And some people have trouble with a story because it's got details and you have to kind of put it together and it has a structure. But that structure for you is helpful. You can use it. So that's just helpful to know that if it's made into a narrative, it's easier for you. But if even relatively simple information that doesn't have that kind of structure, you do have some difficulty learning and remembering it. Okay?
Okay.
Any questions about those are the findings? Any questions about those findings?
No.
Okay.
So what I'm gathering is it's a lot of...
Pretty on point. You're muted.
Caitlin.
I was just clarifying what it sounds like is a lot of ADHD problems or with the gatekeeping are causing a lot of other problems branching off of that. Is that kind of the gist of what we're saying is because of the attention and the gatekeeping, he's having a hard time processing other things, putting it into his working memory and being able to go from there?
I will add a caveat, yes, but in addition, there is a superimposed new acquired cognitive problem.
Okay.
And that's where that memory problem is indicative of that. That even when we reduce the demands on attention and executive ability, which we understand to be impaired and have been impaired lifelong,
right.
And the stimulant, of course, is helpful with that. I think there's probably more difficulty with attention and executive ability than there used to be. So that's there's been a decrement there. I think you may be having more problems with those now. And then in addition, there's this newer memory problem that's independent.
And the age, due to his age and
yes. Yeah, but it's beyond just sort of normal aging.
Right.
It would be consistent with more than that. Even when we account for age, because there are age-based norms that we use, and it's not only age related. I mean, age is a risk factor for having cognitive decline like that. In memory, but it's more than just sort of there is a decrement with age, but it's more than that.
Okay.
So those are the findings. Any other questions about the findings?
No, they make sense to me. I've tried to adapt and try to use many things to do it. Some of them stupid, but I tried my best to do that, but it was always a struggle for me.
Don't call my grandpa stupid. I don't want to hear that.
Another thing is, Dad, you're so proactive. I mean, you've been working with Ruth, a speech therapist, trying to get your words
We're
out.
in this meeting right now.
Mm-hmm.
Right. A lot of people wouldn't even do that. So,
No, Ruth has been a miracle worker for me.
Right.
About that.
Because I went to her saying, I've got to get better at this, and she has been working with me a lot, and I find it to be very helpful. It takes me longer than average to master it, but I work really hard.
Yes,
She gives me set up problems that I have to solve, and I work very hard. I don't kind of ignore her, and I give her back what I've been able to achieve, and she responds, and she tells me a lot of times, great, great, great. And I think, God, I hope it is. But Ruth works with me, and she's been a blessing to me.
So at this point, this is just nothing can be done. I mean, we're just on a slow.
Yeah.
I think
I'm a hard worker, so it makes it work better.
I would say that yes, there's not really a treatment for neurodegeneration. I mean, there isn't a treatment for the disease process, for lack of a better word. I mean, yes, but there are things that can be done for symptom management and also for you in terms of your function. And
yes.
Many of those things you are doing, and our conversation just now about working with Ruth, working with speech, finding, building that skill. The conversations that you have with other people, I think those are very stimulating for you and important to you. You mentioned how you talk to people, other residents and so forth at Evergreen, and that's really gratifying to you, and that should definitely be continued because I think that's really helpful. There are medicines in addition to the Adderall that you could trial and see if you have some help there too, and that would be something to talk about with Gail, and I will have that in there because it can help with sometimes people feel a little sort of mentally brighter with some of those medicines.
He's not afraid of a medicine.
Yeah, I know that, and I don't mean to interject too much here, but I know that I have a huge struggle with ADHD, and when I, when I've been on the wrong medication to treat my ADHD, I have a more mild version of what it sounds like he's going through now. So I'm wondering, if switching meds and, going off the tried and true Adderall might improve some of these symptoms? What are your thoughts on that? Worth a try?
I think that Adderall is helpful. I mean, based on his report. I mean, I didn't evaluate him on Adderall.
Right. That's right.
Because we try to take that out of the equation, so to speak.
Yes.
You know.
Get him at his baseline.
Yeah.
Okay.
So I don't know that would help the memory problem, because the memory problem is
Right.
we documented that it's separate from the
Right.
The ADHD.
Yeah. And some of those linguistic problems too, that trouble finding the right word and so forth. You are working on that with Ruth, and I think that's, if you want to get better at something, you work on it, right? But there is, as Gabby was saying, there is a decline that is happening. It seems like it's been relatively slow to date. It's been, you described, I think, saying that you were first aware of this a year ago, I think. Is that accurate?
I think it's been a couple of years. But,
Couple of years.
He had a pretty stressful life, taking care of his wife, and
I had a miserable time. My wife was kind of
It
crazy.
was a lot. So anyway, so, but I think it's probably been a few years.
Yeah, and I think, and so in many respects, you're still functioning well and you're in an environment that you like. I think you said you like where you are.
Yep.
And so that's great. Is it who came with you to the first meeting? Was that
That was me.
That was you, Gabby. Yeah.
Okay, yeah.
So it's hard for me because we have masks and then we don't have masks. It's hard. I knew there was another sister as well.
Yeah.
My mom.
Oh, that's your mom, and so that's why. Yeah. Okay. Now I'm oriented. So Gabby, I remember you were saying when we met that you were wondering about hearing.
Yes.
And hearing problems along with cognitive changes can cause more functional difficulty. So if there is a question about hearing, it could be useful to have that evaluated. And I don't know if Ruth could help facilitate that.
He already did.
I'm already.
He's waiting on the
We're
hearing.
going today to. I had some tests, and I'm getting hearing aids today.
Yay!
Oh, great. Okay, that's excellent, because there is they've shown that having hearing problems compounds these things. So that could help you functionally. Yeah, right.
I went, had an evaluation, and I have to tell you, I paid $4,500 to.
Who cares?
Yeah, I don't give a shit. But
Breathe it here, we'll take it.
Yeah, so that's great. That's
my
good.
inheritance down to hearing aids.
I'll tell you, my father calls that, whenever he does anything, he calls it a ski vacation. Spending kids' inheritance.
Perfect.
So the other thing that I wanted to ask about was medicines, because I remember, Gabby, you mentioning, or I think actually it was you, Len, you said something about the medicines, and maybe you weren't. There was some uncertainty. I had some uncertainty about whether how you were managing your medicines. Are you taking them consistently? I know you take the Adderall consistently.
no,
But
I take the other things. The only one is the one for anxiety. I take that when I get
It's
anxious.
Xanax as needed.
As it says that in the prescription.
Yeah.
So I take a little bit of Xanax. It's a quarter of a pill. It's the smallest pill, but it helps me to get that anxiety in check, because I get scared and anxious.
Mhm.
I called Gabby on the phone and drive her crazy, but
Yeah, you don't.
Okay, but sometimes I just get very anxious, and
It's a crazy world.
I'm like waiting for this meeting. I've been waiting for it for so long, but I couldn't sleep all night. I got
Oh.
up at 3 o'clock this morning.